Hello and welcome to this video. If you haven't met me before, I'm Jamie. I'm a doctor of chiropractic as well as a fully certified functional medicine practitioner with the IFM. If you have been following our content for some time on our channel, you would have seen that we've done quite a lot of specific content on the long COVID problem. However, today we're going to go actually through a real patient journey and show you how we've been working with her and how she's recovered, so that you can see that this is doable. There is solutions for this, despite the still lack of certainty and still lack of answers, especially in the mainstream healthcare setting. And it will also show you a little bit how functional medicine works. There still seems to be some ambiguity about what functional medicine is, how that can help you. So it's really going to show you how we approach someone with a complex chronic illness like long COVID, and show you the system and how we approach that. Because this is what functional medicine really is. Functional medicine is all about understanding why someone has got sick. Why has this person picked up COVID and got sick from that? And it's really a system. It's really a way of approaching someone and a model and a roadmap for us to navigate through that case. So hopefully that gives you a lot of value. Before we jump into discussing the specifics on Ellie's case, who kindly gave us permission to share her story, we're just going to talk about what you're actually looking at right here. Before you're probably already thinking, what the hell is all this scribbling on the board? I can't read the writing, it's too small. So don't worry about that. I'm going to talk you through this whole process. But there's a few different things we use in functional medicine when we start approaching someone's case like this. So the first tool we use is something called a timeline. And this is Ellie's timeline. So we have her birth here, her family history here, and this is where she's at now, at 30 years old with long COVID. And effectively, when we take on a new patient in functional medicine, we always create this timeline of their whole life, and we look at the things that have accumulated over time to see what may be else contributing to this and help us to understand why they've got sick. The next tool we use is something called the ATMs. So A stands for antecedents, the things that were in the past for Ellie, which predisposed her to getting sick. The T is for trigger. So as clearly we know, COVID infection was the triggering events for her developing long COVID and being chronically sick. And then M stands for mediators. What things are currently in her life, in her environment, which are maintaining her sick state. So when we approach someone like this, we know COVID is obviously a triggering event. That's the cause, we can call it. But it's often, so many times with COVID, it's a fact, it's almost like the last straw to break the camel's back. It's the accumulation of other stuff before, the antecedents, other things going on in life, which brings them to this point where there's this breaking point, and COVID overloads the whole system and causes that onset and cascade of illness and inflammation. Now, a lot of people, they come to me as well and they say, I was completely healthy before. So it is always shocking to see how much someone's life has been turned upside down by COVID, especially vaccine illness as well. I know a few of you out there are watching this and experiencing that as well. And it seems to be, there's a real powerful impact on the immune system from that. But we can always find things. There's always a reason why someone has caught COVID or got the vaccine administered and has developed chronic illness. Whereas the majority of people, they caught COVID, they were sick for a short amount of time, and then they were well again. That's normal. But there's a reason why someone caught COVID, got sick and stayed sick. And it's often all these underlying things which have accumulated, which helps us to understand that. So ATMs is how we can start making sense of this patient's journey. The next thing we're going to introduce you to is something I'm going to call it GOI, which is another tool we use in functional medicine. Actually, in functional medicine with the IFM, they use a longer acronym for this. They call it the Go To It model. But for the means of this video and to make this more streamlined for you, we're just going to shorten that to GOI. So G standing for gather. The first thing we want to do when we approach someone like this is gather a lot of information. We really want to understand them as a person, what's going on in their life, what's happened in the past, what's been the environment around when they've picked up COVID, because that's critically important to understand why they've developed a chronic illness from this. So we're going to gather a lot of information, first step. O is organize. We're going to organize once we've got all this information, which is, already looking at the information on the timeline, it's overwhelming. Where the hell do we start? So we're going to organize that information, create an effective roadmap, a step-by-step plan for her to follow to get well again. And then lastly, we're going to implement. And over time, we're going to track that and get her to start new things, the next stage of her journey. So these are the two tools we use to just organize this whole situation. So hopefully that gives you a little bit of a grip on where we're going to go with this. And just before I jump in, because I know this can get a little bit overwhelming, the amount of stuff and information, it's information overload often with functional medicine. So we need a tool and a system to approach that, to keep it organized and keep control of it. So let's talk about Ellie specifically. So when she approached us, like we said, she was 30 years old. She had picked up COVID a year before in, I think, 21. She approached us in 22. Her main symptoms with long COVID, fatigue was the critical one, as many other people with long COVID and also other chronic illnesses. Fatigue is probably the biggest symptom people experience with a post viral illness. But there's a whole lot of other stuff going on. But we're just looking at her initial symptoms. We can start to get a grasp on maybe what mechanism is going on, how the pathophysiology is occurring within the body, how the illness is occurring. So when we see someone with fatigue, we can expect, they're obviously not producing energy well. So there's a potential, there's some mitochondrial dysfunction happening. And that makes a lot of sense. It happens a lot with post-viral illness. We know viral elements, they manipulate the mitochondria to help them replicate in the cell and help them survive. The inflammation and oxidative stress that happens with the immune response really clogs up our mitochondria, creates a lot of damage for the mitochondria. So fatigue is a really common thing to see. But fatigue appears in so many different scenarios. So when someone approaches us with fatigue, we really have to cast a wide net because it can be caused by so many different things. There can be very physical things causing this, viral things, toxins, there can be inflammation happening. But we know fatigue can be really driven by, stress, adrenal dysfunction, just not having enough purpose in life and just feeling flat and demotivated. So fatigue is a real subjective thing we need to interpret and where that's coming from with them and take a very individualized approach. So mitochondrial dysfunction is one thing that we're suspecting with Ellie. There's other things that really make us suspicious of that as well. So she's also experiencing burning sensations, numbness, headaches, cold hands and feet, which could also be tied to this. When we see mitochondrial dysfunction, we generally see that manifest in pain, brain, and drain. So drain obviously being the fatigue, brain and pain. So what you understand about the brain and the central nervous system, it requires lots of energy to work. So it's very energy dependent. So when we're not producing energy well, there's mitochondrial dysfunction happening. These things start to suffer. We start to lose our cognition. We don't have enough. We can't concentrate as well. Our memory isn't as good. We can get depressed, mood disorders. So these are things that can typically happen within the brain. When we look at more the nervous system, we can start to see how the nervous system not working properly. We start developing altered sensations around the body, numbness, burning. So there's potentially some more evidence of this occurring, which could be related to her symptoms there. However, there could be other reasons for this. So, we also want to keep in mind that, burning, numbness, as well as a few of our other symptoms, we want to keep in mind that also with long COVID, one of the key mechanisms of how that occurs is also obviously autoimmunity. So we want to keep in mind that there may be an autoimmune process happening with this patient. And we know that with COVID, it can trigger an autoimmune reaction against nervous tissue. So that may be a possibility. We also know with Ellie, she actually presented, she went to her doctors like you're supposed to do. She went to a mainstream doctor, they ran some tests. She did have a positive ANA, which is one of the main things they'll do to run a test when they're screening for the presence of autoimmunity. So it was positive with her, but there was still some question marks whether that was actually significant. And likely they're still not sure about that because her symptoms, her symptomology wasn't quite fitting to the diagnostic criteria of something like lupus or MS or one of these other chronic autoimmune conditions. And this is something we discussed in a whole video on autoimmunity and long COVID. So if you haven't watched that, go back and watch that if you're interested in that discussion. But we talked about how sometimes, there is an autoimmune process happening, there's damage to self, but it's not quite severe enough or it's not quite clear-cut enough to be put in a diagnostic box. So, but there's some suggestion of an autoimmune process happening. She's also got some joint pain, so that makes us a little bit more suspicious as well. Like, is there an inflammatory arthritic thing going on here? So they're going to keep this on our list. The next things that we can extrapolate from her symptoms. So she has mood, anxiety problems. She has dark eyes. We talked about how maybe a mitochondrial dysfunction is happening, which can affect her mood. Also, inflammation will dramatically affect our brain and how we feel. But also, this could suggest an MCAS, the presence of MCAS. And the reason being is that MCAS, if you don't know about MCAS, again, we've done another video on this to do a bit of a deeper dive into that. But with MCAS, we get a lot of histamine response in the body and histamine production. And what we know about histamine is it's very neuroactive. So it can act on the brain, especially trigger things like anxiety. Dark eyes are actually quite a common symptom of MCAS as well. Dark eyes and rings under the eyes, it's generally just a sign of being sick, that sick image. But it shows up a lot with MCAS and also food sensitivity. That's another thing that we're going to put on our list of potential things going on with Ellie, whether food is playing a role in this. And we know that 70% of the immune system sits in the gut. A large part of that is going to be mast cells. Mast cells sit on the barriers of our body, our skin, our lungs, our gut lining. So that's really where they're going to hang out. And if Ellie is eating foods which are causing inflammation and the immune system doesn't like, it's going to upregulate that mast cell activation. So what else? The cold hands and feet, that's another thing. So many times with long COVID patients, there's dysregulation happening. There's this presence of something like a dysautonomia, POTS-like symptoms. So there's suggestion of that occurring with her as well. But it tends to be, dysautonomia, POTS, often they are a sign and a result of underlying inflammation or even autoimmunity. Once you get the inflammation sorted, get the autoimmunity calmed down, then you start to see these things typically start balancing out. But, cold hands and feet, palpitations, just not regulating well, all signs of the central nervous system, again, not working. So again, it could be a sign of mitochondrial dysfunction. So a lot going on here, as you can already see, and you're probably already feeling a bit overwhelmed. So we know, but we have some potential mechanisms going on with what's happening with Ellie. The next thing we need to do is understand how, why are these things happening? How has she got to this point? Because if we can identify that, we can start identifying solutions, how we can peel back the layers and unravel this. So let's start going through her history a little bit more beyond her her presenting symptoms that she's coming with us presently. So, before she got to COVID, Ellie was, a very social girl. She lived in London. She was really passionate about exercise, socializing. So she hadn't worked for about 7 to 8 months when she first came to see us. So she's been really significantly impacted by this. But when we start looking back through her history, we can start to make sense where problems have started to accumulate. So actually during childhood, there's not a lot going on, whether that's she just can't remember things or she didn't think they're significant or actually childhood was pretty good. There's a little bit of family history, some cancer, some hay fever. Potentially the hay fever can link into histamine issues. Maybe that's linking into the MCAS, some cardiovascular stuff as well. But generally, early years, fairly insignificant. However, there are some things that she feels like have been going on really forever. She has always been felt like she's quite hypermobile. And that's quite an important thing. And it can indicate potentially, if the hypermobility is bad enough, it can indicate a problem with collagen formation in the body. And that's really important with a case like this, because if our collagen isn't being formulated properly, we haven't got strong barriers from that, that's going to directly increase the risk of things like leaky gut. Our barrier systems in the body need to be strong to prevent things coming in, which may irritate the immune system. So if our barriers aren't strong, it's more likely things are going to come through. The immune system starts seeing things which sees as a foreign invader and starts mounting immune responses and inflammation. So there's a potential that there's a genetic thing going on there with the hypermobility. And like we say, that can lead to the risk of leaky gut and increase the risk of things like food sensitivity. So there's again something pointing again towards potentially food. At 17, 18, later in her teenage years, she starts developing migraines. Again, migraines, headaches often have a food-related component. So again, another thing relating to food. Again, another thing that she feels like she's had forever is these problems with like fungal nails, so yellow toenails. She just always really struggled with that. And that is obviously, it's obviously a fungus, but it's a sign that there's systemic fungal overgrowths occurring. And often the main reservoir, the primary reservoir for that is in the gut. So the gut is something we're critically going to look at, and looking at the microbiome. So with Ellie, if there is an autoimmune process occurring, re-establishing order in the gut, calming down the gut and restoring the balance in the microbiome is very, very important, because what we know about the gut, again, 70% of the immune system sits there. If there's pathogenic or unwanted stuff there, the immune system is more likely to be triggered by that. So we want to get rid of maybe some of these overgrowths of fungus, potentially pathogenic bacteria, and rebuild the probiotics. And the probiotics can help to crowd out the bad stuff, but they also train immune tolerance, which is critical for autoimmunity. The good bacteria, when we have a healthy abundance of good bacteria, they almost train our immune system to recognize good from bad and what to react to and what to not react to. It tends to be if we don't have enough bacteria around us, we're too hygienic, we don't get the education for our immune system, and it starts therefore reacting to just generally all bacteria. The probiotics will deliver a lot of things like short-chain fatty acids, butyrate, which are very anti-inflammatory, help heal the gut wall. They help to calm down inflammation in the brain. So gut is again going to go on our list. So next thing we see on Ellie's timeline, a big thing that jumped up for me when I was reviewing this with Ellie is the amount of other viral stuff going on. It's not just COVID, you know, there is the chlamydia, there's EBV, there's glandular fever. Actually, when she caught EBV when she was 21, she was bedbound for about 3 months, had to take out a year out of university. So she had a lot of this post-viral fatigue after that scenario, similar to what she's experiencing now. There's also HSV2 later on in the 20s, mumps virus as well, just before she caught COVID. So she's just really susceptible to picking up viruses. And that's a direct clue to it's a direct clue to pay attention to, because it's exactly the same for COVID. She's susceptible to picking up viruses in general. There's something affecting her immune system which allows viruses to come in the body easily, start replicating more and causing more damage. So our critical question for that is obviously, you know, why is her immune system compromised? Why is these things allowed to happen? And that's the same for like microbiome imbalances. Why are opportunistic things like fungus, candida allowed to come in and take up residence in the body? Now, one thing that we can maybe interpret that already with Ellie is, you know, is there like these food sensitivities underlying and inflammation coming from that? Is that underlying the immune suppression? Because what we know about inflammation, immune activity, it can cause cortisol increases, and that can suppress the immune system, like we all know. So, you know, stress, cortisol, suppress the immune system, but that can come from physical causes like inflammation. So that's a potential. But always when things start cropping up in life for someone, we always ask the question, you know, what was going on in life at that time? And you tend to find that always correlates with stuff going on in life. So we can see as she reached her late teens, early 20s, she's gone to university. And we can all guess the type of lifestyle choices she's making there. She's probably eating more foods that she's potentially sensitive to, which is causing more inflammation. After uni, she actually went to London, and this whole time she really picked up this habit of over-exercising, becoming very results-driven. She's always on the go doing things. So there's this burning candle at both ends, drinking a lot, going out partying a lot, working hard in the gym, getting up early, going to CrossFit was one thing she was doing. So there's a lot of burning going on, and we can see how that's, you know, providing a massive stress on the body and potentially causing this immune suppression and allowing her to pick up viral things. So that really starts to make a lot of sense. And we can see how that's starting to manifest with symptoms for her. So she's getting more disruption and dysfunction in the gut with diarrhea episodes. And that's likely, you know, a sign the body's trying to just get rid of unwanted bugs in the stomach, which are allowing to come in with the amount of stress going on. She's probably eating foods that the immune system is not liking. So there's a lot of the diarrhea happening. With the EBV especially, she picks up a lot of stuff. So like we said, there's a lot of fatigue happening, sinusitis, angular cheilitis, which is basically, you know, sores in the mouth, which can indicate a few things. It can typically indicate deficiency in some nutrients, so iron being one, B vitamins. So there's some suggestion of poor absorption going on in the body. But it also can be a symptom of gluten sensitivity. That's another thing that can be causing this. So we know food may be an issue here, as well as absorption in the gut. She did actually have a lot of other symptoms going on, looking at, you know, just poor absorption of nutrients. She had dry hair, which she had been struggling with for a long time. She had dry skin, so potentially, again, linked to zinc, but also maybe poor absorption of fats. She had white spots on the nails. A big thing was zinc again. We know about zinc, it can be used up a lot by the immune system when there's a lot of inflammation floating around, so that's potentially contributing to that. But also when our stomach acid levels get depleted, typically through stress, we don't get absorption of these types of minerals. So we start to see that really manifests a lot with the skin, nails and hair. But in helping her recover and get on top of things, we really want to start getting her to start absorbing some of these key nutrients because she needs that for her recovery process. So we see this big picture of developing like high stress lifestyle, picking up more viral things, collecting more symptoms, and then we get to the period of the initial COVID trigger. And again, what is happening around life at that time? And she told us again, stress is a big thing with work, and so many times, people become better at being stressed the more they do it. They become practiced at being stressed. Just the way they navigate the day, they just attract stress into their life. So she's just got this ongoing stress going on, which has just led straight into this. She also has been being exposed to mold. She's aware that there's mold in her environment. And again, with mold, that's really important because we know it suppresses our immune system. It causes a lot of inflammation. It will really trigger a lot of MCAS type phenomenon in the body and can cause a lot of symptoms. So in getting over COVID, that's going to be a really important thing. And then she also starts taking, around that time as well, she starts taking courses of steroids for the onset of hemorrhoids. So her gut has got so bad over the years that, firstly it's getting quite loose stools, things are trying to get rid of stuff, but there's accumulating inflammation, there's likely food sensitivities that are being around, more and more dysbiosis, imbalance in the microbiome, and we start developing constipation. And that can happen a lot, constipation, shutting down of the gut can happen when, we're just stressed anyway because we're in this fight and flight sympathetic point. The parasympathetic side of our nervous system shut off, which is all about digestion. So our digestion isn't going to work well at all. But when we've got a lot of inflammation going on, that can actually cause a paralysis effect of the muscles in the gut. So we stop getting the squeezing through the intestines to move things through. And that causes a lot of fermentation of food just sitting around, triggering the immune system a lot as well. It causes a lot of bloating, gas production, typically comes with IBS. And the hemorrhoids are a direct association with that. But she has to start taking courses of steroids for this. So the first course she had was, I think it was like 10 weeks every day of steroids. She has to do maybe 3 or 4 courses through the year. And we all know about steroids. Again, it tends to suppress our immune system. That's the side effect of that, or the direct effect of that if you're using them for managing an autoimmune condition. So there's a lot of, again, picks up COVID in the environment of stress, mold, steroids all use, and this whole accumulation of stuff before. So when we start looking at the history, it can really start to make sense why someone has got chronically sick from this triggering event. And this is really not unique or rare thing. This is a very common scenario for many people I've worked with long COVID. So hopefully that has been interesting for you and has provided some value as I've tried to explain what my thinking is around the problems that she's come to me with. And I hope you're not completely overwhelmed now with the amount of information. Like I said, it's really drinking from the fire hose, this stuff, and it's information overload. And we can see how, our normal GPs don't have the time to sit down with someone and discuss their whole life, their stress, their past infections, their fungal toenails, and there just isn't the time for that. This whole process takes around definitely over an hour, hour and a half, 2 hours sometimes usually. So we really spend a lot of time gathering the information and understanding Ellie to help us to know how to help her. So you're obviously thinking, yeah, get to it. What are we actually going to do for her? How are you going to go around this? So the next step on our GOI, we've gathered the information. The next thing is we're going to organize. So how are we going to organize this whole mess? What we're going to do first, what's the roadmap, how she's going to recover, and what's the step-by-step process. So things that we're going to work on. We're going to work on food and specifically address and identify the food sensitivities which may be underlying. We're going to address the mold she's currently living in. That is priority. We need to get someone out of mold if they're really gonna get well again. It's very hard to get well when you're living in a moldy environment because it's just sustaining so much immune activity. We wanna help her sort out her stress. We need to get her out of this sympathetic more into parasympathetic. We need to help her, you know, long term, we need to help her to learn how to get a better life balance where there's more calmness, there's some more relaxation. She's not on a hamster wheel all the time, because if we fix this and she hasn't fixed that, it's just gonna go straight into it, picking up another bug or another virus in the future. We need to help this person be well for life through this process, and getting lifestyle things like managing stress and how we conduct our life is critically important for that. We are going to also balance the gut. We're going to identify the types of organisms going on, how much fungal overgrowth is going on, any candida, rebuild the probiotics, rebalance some, restore some balance there in the microbiome, heal the leaky gut, and also just get this gut moving again. And that's going to come around with, you know, removing the food sensitivities and restoring the microbiome to calm down the immune activity. But we want to get this gut moving again and sort out the constipation, because when we get constipation, we're not eliminating toxins out the body. We're really harboring a lot of toxins. Our toxic load goes up, and that can contribute more to this whole mess. So first thing we did actually with Ellie was we ran a few tests actually. We investigated the mold a little bit more. So if I wipe this off, because I'm running out of space on my scribbling. So we actually hired a internal environmental professional to come and investigate our house to see what the extent of the mold was, where it was coming from and what was causing it. So they actually ran some tests. They found that she had a spore count in her bedroom of 11,000 compared to just normal outside environment of 1,500. So she had 10 times the amount of spores in her bedroom especially. There's some in her living room and kitchen as well. Kitchen was a little bit worse as well, but bedroom was the main source of that, which is obviously spending half her life in sleeping every night. So you can see how someone's not going to get well if they're sleeping in a bunch of mold spores. It's going to really sustain the MCAS, really sustain the fatigue, especially a lot of cognitive issues with mold exposure. So that brought back a lot of results. We also actually ran a viral panel as well, a viral and Lyme panel, just because the amount of viral things she's been susceptible over the years and harbored in the body. We know that reactivation of viral species like EBV can be one of the main mechanisms of COVID. So we did do a viral panel to check that, but that was actually clear. So that sort of eliminated that process off our list of things. It seemed like mold was one of the more important things to do. So the first things we did for Ellie was, you know, really start supporting the body in that moldy environment as she was trying to work out how to get rid of it. So, you know, first thing she was doing was she was drying her, you know, London, there's a lack of space. Not many of us have a garden in London. So she was drying all her clothes in her bedroom, providing a direct source of moisture for mold growth. So, you know, we tried to just sort out the environment, removing the moisture, increasing the airflow, get the humidity down, as well as set her up with some support for her body. So we set her up with a binder to bind up the toxins that typically come from mold. We started supporting her with antioxidants. She was already taking glutathione as well, because that can manage and counteract the oxidative stress and inflammation that comes from these things, and also some liver support. You tend to find that you need to detox mold out the system because it releases something called mycotoxins, and mycotoxins need to be detoxed through the liver and eliminated. Alongside her specific mold recommendations, we also did a few other things to get her started. So we recommended with food, you know, we recommended she follow just a gluten, dairy-free approach. She was already following like a low histamine approach, as many other people are trying with long COVID, because they've heard, you know, MCAS and histamine played quite a prevalent role. But we actually recommended she just started implementing histamines again, because I never really like to keep people on that for long term. So if they haven't found a significant improvement and stabilization within their situation with following a low histamine diet, then I tell them to bring it back in, because it typically removes a lot of healthy fats, a lot of healthy foods that we don't want to keep out the diet for too long if it's not necessary. So she hadn't found any real significant improvement by doing that. So we said to just bring it back into the diet. Is more than likely the underlying mold and other factors are really stimulating any MCAS situation going on for you. But we wanted to maintain gluten dairy free, as we know those are the two biggest the two most common food sensitivities likely to be going on with someone like this. So she did a really good job of that. With the gut, we got her to start implementing, daily smoothies, sometimes just for breakfast, just getting loads of healthy fats in there, more fiber, antioxidant heavy foods, which really help to provide anti-inflammatory effect for the gut, for the body as a whole, but also to help just get some gut motility going. With the fiber and healthy fats, they really help to lubricate the gut lining, and it helps to just get the gut moving a little bit more and reduce this constipation that she had going on, which she found really beneficial. Alongside that, in the gut, we got her to start taking in some vitamin A. We know vitamin A is essential for the immune system when it's dealing with a lot of stuff, so it's a good supportive nutrient to use. We know vitamin A is also essential for essentially keeping our barriers strong in the body. So we come back to this hypermobile point in there's more likely this leaky gut effect going on with her. So vitamin A is going to provide some support in keeping things intact. We also got her, alongside the mold, environmental mold stuff, we got her to actually start taking some antifungal supplements as well, because she had this symptom of white coating on the tongue. And that's a key sign of candida and yeast colonization in the body. So we really wanted to get on top of that and start nudging the microbiome in the gut into more of a balance point where there's less of this bad opportunistic stuff and building up the good stuff, which comes with supplying the fiber for the probiotics to grow, bringing in probiotics a bit later as well. But the impact the environmental mold was having on her was really amplified and indicated by this symptom, because she spent some time outside of the house. She went to visit a relative and stay with them for a little bit of time because she was very keen to get out of this moldy environment. And within that time, alongside the other supportive measures we were making, her fungal tongue, her white coating on her tongue completely cleared up. But she had to go back to the flat for one night, and just with that one night, her tongue came straight back again. And what we know is with things like Candida, like we said, the opportunistics, they tend to come around when there's immune suppression occurring. And we know when there's mold in the environment, that can cause immune suppression and allow these opportunistic things to start flourishing again. So just chucking antifungals at it is just one part of the process. We need to understand, again, why is the Candida overgrowing and allowed to do that? And then lastly, for her initial stuff to work on, we talked a lot about stress. In learning and practicing how to be less like type A mentality, really results and goal driven and seeking more balance in her life, that's going to take Ellie some time. And this is what our health coach Kirsty really does an amazing work with people on. But first thing we introduced to her was to just stop with the cold showers, the excessive fasting. She was doing loads of this stuff, which many other long COVID people I find are trying at the moment. And during this initial stage when they're all over the place, there's lots of symptoms going on, lots of inflammation, often a really good thing to do is actually to reduce the stress. And that may involve reducing some of these stress-inducing activities, which are touted as being healthy, and they are in the right circumstance, but they're healthy because they provide a stress onto our body and get our body to adapt to that. And that can be quite stimulating for our body. But when we're dealing with too much stress, too much inflammation, it's an additional stress to deal with. And if they haven't got the capacity to deal with that, then it's often good to remove those things initially and then bring them back in later. So we actually reduced some of the things that she was trying already to try and reduce the acute stress on the body while she's dealing with this stuff. So initially with Ellie, we obviously worked on tackling quite a few different areas which were playing into this for her. And she actually took it upon herself eventually just to actually sell the house and get out of there and move on, which, you know, that is a extreme last resort scenario for a lot of people. You know, that's a big commitment to take. But for Ellie, I really respected her for making that decision, because it really highlighted her commitment to embracing change and trying to move forward with life, and her commitment to really getting better again. For her anyway, this was maybe an easier decision to make because she wasn't too happy with the place she was in. A part of her was ready to move away from London anyway. So she used that to her advantage and she moved on. But this is maybe a little bit of a lesson and a concept to take on if you're in a similar position where, you know, a lot of people, they want to get better, but their mindset is in the wrong position. A lot of the discussion, especially long COVID patients, they just want to get back to how things were. They just want to be back to normal again and back in their old life where things were okay. But sometimes, you know, in order for us to get better, we have to sometimes let go of things and move forward. You know, we can't go backwards in our life. We have to embrace moving forward and get this momentum and start envisioning new things and bringing new things into our life to produce some momentum and some progression for us. And this is one thing that Ellie, you know, did really well. So, you know, we rolled with this picture and this plan for her over the next few months. And by the time we got to the 6-month stage, she was really doing a lot better, you know. Oh, how did that work? There you go. So at 6 months, she was about 40 to 45% energy, which isn't a huge amount, but it's doable, it's manageable. Initially, she was at 15 to 20%. Now with that energy level, she picked up a part-time job. She wasn't wiped out completely with daily activity. She could do things, get out and about a little bit more, have a little bit of social contact. But it just highlights, you know, this is really a journey and it's not an overnight process for many people. Like so many long COVID patients are looking for this curative, like wonder supplement or drug to fix them. And it really isn't about that. It's really about creating an environment for your body to recover and heal. And once you've got that in place, your body will do that. And it just takes time for that to happen. But, you know, for every individual, that happens at a quicker pace or slower pace, depending on who you are and your background and age and what you've been through. So, you know, the most important thing is making sure you're moving in the right direction, not how fast you're going or where you are in that point. It's really which direction you're going. So, you know, she was happy that she could see progress happening. Her symptom score was right down. Initially, it was in that mid-40s. Now it was about 21. So a lot of things had improved for her. But there was still obviously some improvement to be made. So we went back to the drawing board, scratched our head a little bit and looked at other areas we could harness. We did try a ketogenic approach to see if we could stimulate some more beta oxidation in the mitochondria, some more use of fat as fuel, which will typically give you the same effects of fasting without fasting. But you know, that didn't really actually create much response to her. We also decided to run a few tests to get some more objective data. And one of them was the organic acid test, which is a really useful test to do because it gives us information on multiple different systems in the body and where to look at. We wanted to look at a little bit more at her fungal levels to get a picture and an indication of what was going on in the microbiome. So the organic acid test is a very accurate and sensitive test for doing that. Her fungal levels were completely normal on that test result, which was great, but we did pick up some other information. Her glutathione was down, so some indication that she was either not producing glutathione well or just using it up a lot. Her oxalates were elevated as well. And when we see oxalates elevated on the organic acid test, the number one reason for that is actually underlying fungal candida yeast issues. They're one of the primary causes for that being elevated. However, with Ellie, that wasn't there. So the next things that can cause that, sometimes, you know, if we're eating a diet with a lot of oxalates in, especially these like green smoothies or a lot of sweet potato, that can push up oxalates, but that tends to be a thing to be concerned about if there's like a high fungal thing going on pushing up oxalates, and sometimes a low oxalate diet can be useful just to try and control that a little bit. But the next obvious cause for high oxalates is poor fat absorption. So the reason for that is that fat typically carries a negative charge. So it will bind to things that have a positive charge, like calcium, and it'll also bind to magnesium typically. And the relationship to oxalates here is that oxalates also carry this negative charge. So they too like to bind to positive things like calcium. So if we've got a lot of fat sitting around in the gut, it will basically bind onto the calcium and magnesium. And therefore it will compete with the oxalates for that. And because it's binding up more calcium, it will leave more free oxalate available to be absorbed up in the gut and into the body. So you start to see this rising level of oxalates in the body. So this is really critical information for like people that deal with a lot of kidney stones, because oxalates are these sharp crystally type things that typically make up a lot of the stone formation in the body. But for us, we again want to question, okay, why is she got this fat malabsorption going on? Obviously makes sense why she didn't respond to the ketogenic diet, but it can indicate a low bile or low liver function. So we get this indication that bile, liver, the detox system is an issue, and that would make sense why she wasn't dealing well with the moldy environment, because she perhaps has an issue with detoxing, and a lot of the time this comes down to genetics. So alongside that picture, we also thought it'd be a good idea around this point to, you know, check out what was going on with the mycotoxins that may have been left over from all the mold exposures she was getting. And this is one thing to understand about mold, is just because you get away from the initial exposure, you can still be sick because the mycotoxins can reside within you. So for Ellie, we wanted to understand if that was still a big thing affecting her. And with her, we found an elevation of ochratoxin. And what we know about ochratoxin is it's typically nephrotoxic. So it causes a lot of issues to our kidneys. And just going through this again, it reminds me of another strange symptom she had at the start. She had this sediment and crystal like formation in her urine actually. And when she got out of the moldy environment, that cleared up. But it made me think that perhaps this was coming actually from the buildup of mold and toxins from that and damaging the kidneys. It's also carcinogenic. It's also neurotoxic, so it can cause a lot of neurological disturbance. It's also immunotoxic, so it can screw up our immune system. Again, coming back to that immune suppression point. So that gave us some direction to follow, and you can see how just as you start to peel back the layers with these types of cases, you start to learn new things, and you have to take a step back and reevaluate and look at the next direction to take. So we recommended that she continue to use a binder to try and bind up some of these toxins to get out the system. And what we actually found with Ellie at this point is that when she implemented the binder, her fatigue came straight back again. Her MSQ score also jumped from around 20 back up to 39. So So that really screamed out to us again, this underlying detox, potentially bile liver issue. Because if you're binding up toxins in the body, the binder is going to take the toxins to the liver to get them rid of. And if the liver can't deal with that, it's going to back up into the system, create inflammation, and really drive a lot of the fatigue and symptoms someone gets. So that really confirmed our suspicion about that fact. So that really helped us understand how to help this person, and it really indicated what was one of the primary underlying things with Ellie in being a genetic thing. And so once we understood that and had more understanding about that situation, we provided the necessary support for that area. I think off the top of my head, we used a B complex for methylation support, as well as DIM. And once we set her up with that, we really just let things roll out over the next couple of months. She immediately, once we set that up, her energy bounced back. She really got back to that 40 to 45% plateau that she was on, which was a positive thing, getting back to the point she was. But after the next couple of months, just letting that roll out, she really started to bounce up to around 70%. And that came through, the ongoing support on that front, as well as working with our health coach, Kirsty, who really helped her with the mindset of recovering from illness, getting her to set goals, helped her with pacing, activity, graded exposure to new things over time. And over a couple of more months again, she reached around 85 to 90% in her energy levels. And this was a real sort of conservative measure from her. I think, all of us, it's hard for us to say, yeah, I'm 100%. We're always fluctuating between being, feeling really well and then feeling like, okay, I need to just clean up a little bit. I need to work on myself here and there because I'm not feeling quite up to that point. So it's always good to, I think at Ellie, she was saying that because she knows, I think everyone's got this little gap where they can improve a little bit. But a lot of the time, people get to this point with long COVID recovery or recovery from another chronic illness, in that it's this point where they're not sick anymore. They're trying to relearn how to be, normal again. And that's a huge thing after you've been sick for a number of years. You really have to almost find a new way of being again. And that's quite overwhelming and a big thing. But, she was doing so much better at this point. She's back to working 5 hours a day. She's exercising regularly. She's socializing without getting any knockbacks. And I think, it's unfortunate we didn't get to do any specific genetic testing with Ellie. She just felt it wasn't an investment she was willing to make. We recommended that she continues on some methylation support, because I think if we did run a genetic panel with her, we would find she would have genetic SNPs mutations in certain detox genes, such as NTFHFR. And we're finding that a lot with long COVID patients. So we just recommend that she continue with that for now. So that really brings us up to where we are around now. If you're still with us, well done for sticking through all of that. I know it's very overwhelming and there's a lot of information to take in. So, hopefully that's made sense and you've taken some value from all that discussion. I've tried to talk about some of the explanation behind a few things, the theoretical side of a few things, and maybe you can apply that to yourself as well. But I think the main things to take from this is, firstly, it is very doable. You can recover from things like long COVID. Secondly, it is a journey. It takes time. It takes perseverance, and often it's helpful to work with someone to have this objective viewpoint on how you're doing and provide you that roadmap on what things to work on, what things to implement next, so you have this building up of progression over time, rather than this stop-start guessing approach you get with a lot of people trying to do it themselves. But please give us some feedback on how you felt that was for you, if you found that useful or not. It's the first time we've shared a patient journey like this, and I'm aware this is a really long video. So please leave some feedback. If you want to see more of this, please comment below.